And what's the most common cause for death?
Blood clots. We're seeing loads of people with unnatural blood clots, like white calamari inside them. The coroners won't talk about it. They just don't seem to want to talk about it. Heart attacks, strokes, cancers. They're not cancers. It's these white clots inside them.
And what do you think they are?
I think it's a result of COVID vaccines. And it's been well documented by people far cleverer than me. And I've been shouting about it for years. But people just don't seem to want to acknowledge it. Mostly people like the coroners, most doctors, government ministers, they won't talk about it. They don't want to know. I've even been to the police station. They don't want to know. They won't even talk to me about it.
And what do these clots look like?
I've got some here if you want to see them.
Yeah, yeah, go for it. Wow. So all of these sort of calamari-looking clots,
yep,
you've taken them out of people's
Personally.
circulation system.
So there are two types of death. We've got an expected death, where there's no need for a post-mortem, and then we've got an unexpected death. Early on, we were finding them in post-mortem cases. So the way that works is we had a young lad of 30, and he died suddenly, and the family asked us to embalm him. Now, because he'd had a post-mortem, he'd been opened up and chopped about, and then they put all the bits back in and they sew him up. So obviously his circulatory system has been compromised, and when we embalm someone, we use the circulatory system. So the way that works is on a straight case, someone that hasn't had a post-mortem, we call it a straight case, is they make an incision there on the carotid artery, and then we've got an L-shaped nozzle that we pop down the artery, we tie it off with twine, and they pump formaldehyde around the body using that circulatory system, that artery network, and it goes everywhere. And the idea is to get formaldehyde all around your body, and there's a couple of purposes. One is the fluid is pink, so it adds colour back to someone. And number two is it preserves them. It's got like preservative properties, formaldehyde. So it stops the deterioration in the body, stops nature taking its course, and it presents people better. Now, if someone's been chopped about after a post-mortem, clearly you can't do that, because if you picture it, you connect there, it would leak out everywhere where they took all their organs out and put them back in. Because every organ has arteries feeding it and a venous supply, like a veins returning. And so this particular young lad, we undid the stitches, we took the organs out, and then you have to manually target all the severed arteries inside the body cavity. And you can see them, and to picture them, it's like cut straws. You know, like you get a McDonald's straw, imagine that cut sitting inside your body in the top of your leg. You can see that's the femoral artery. So you target that, and then you tie the pump to it, you pump fluid down it, and he would move the leg about to get the fluid moving, and you would see his toes go pink as the fluid reached the bottom of the toes. So then you could stop, knowing that the full limb was embalmed, and you go to the next limb. And this lad, when we tried to do this, his femoral artery was blocked. So my embalmer, and he's BIE certified, he's done 24 years, I think now, got the tweezers and pulled this obstruction out to be able to get the pump in. And he's pulled and pulled and pulled, and he's pulled out a clot the entire length of this guy's leg. And I've never, ever seen, I mean, I worked for the coroner for 7 years. I've never seen anything like it in anyone before. He's done 20 odd years. He's never seen anything like it before. And we're finding this now constantly inside people that have all been COVID vaccinated. So that's what we're seeing. So I reached out to my local coroner and kind of said, look, I'm really concerned, you know, we've got a young lad of 30 in, we've pulled out about half a pound of this crap out of him. I know you've post-mortemed him. What is it? You know, what is it? We've never seen it before. Do you need samples? Have you got samples? How can we help, you know? No reply at all, firstly, by the email. And I emailed because I wanted a paper trail, because I knew then what was happening. I took a phone call about 4 days later. It was from one of the girls in the office who doesn't work with bodies. They're in the office. And she said, well, we spoke to the pathologist. He said, don't worry, you can dispose of them. It's perfectly natural. It grows post-mortem. So what that means is basically they're saying that when you die, rubber grows throughout your arteries all of a sudden. And it's perfectly normal. Well, I can tell you, having done this job for 18 years, 7 years picking up bits out the road, that isn't normal. That isn't normal. And it's only, and every one of these people was COVID vaccinated. How do I know? Because I meet the family at the point of arrangement and I ask them, I say, was mum COVID vaccinated? And they say, yes. And they tell me. And because the government made such a big thing about you must be vaccinated. If you don't, you're selfish, you're dangerous, you can't work, you can't travel. You're killing people if you don't. People are only too forthcoming then. to tell you their vaccine status. And they did get good coverage. A lot of people were vaccinated. These are the people that are dying.
Can I pick one of these up?
Yeah, of course you can. Yeah. No, they're sealed. They're formaldehyde.
I'm just saying it's not disrespectful, is it?
No, not at all. This is clinical waste. But these are not normal clots. Usually it's red jelly clots. These are not normal.
And they are like calamari.
Yeah, and they're very rubbery in texture. I wouldn't advise that you get one out and hold it, obviously, but they're very rubbery in texture. They're very tough, and it's very interesting because if you do a search for the drug heparin, that's a blood thinning thing that they use in hospitals to thin blood, and it won't have any effect on this because this is totally different pathology. And John Campbell talked about this extensively with myself and Major Tom Haviland.
I mean, some are really thick.
So this reflects in the size of the vessels that it's growing in. The bigger the vessel, the bigger it's got to grow to block it.
Right.
So the smaller ones are from smaller vessels.
So these clots will keep growing until it fills the space.
Yeah, and then you have a heart attack and die. Right. Or you're diagnosed, or you're short of breath, and you go and he says, "Oh, you've got stage 4 lung cancer," and it isn't that. It's these growing inside your lungs.
After seeing that, what was it like being a funeral director during the pandemic?
So initially, I was very frightened. I'm an ex-smoker, I'm asthmatic. I was, in my 50s, early 50s. I was frightened. And here we're told, I first learned about COVID from, I had a family come to see me who had lost someone in the neighbouring borough of Northampton, at Northampton General Hospital. And we serve kind of 30-mile radius, sometimes do Bedford. And they complained that the hospital wouldn't let them see their loved one, which was unusual. So the way that works is wherever there's a mortuary in a hospital, people die on the ward, they take them down to the ward, and then if you contact the bereavement department, they'll arrange for you to be able to do a viewing. So you can go down and they'll lay them out and you can see them at rest, and they don't make much effort. But, you can see mum at peace, if you like, whereas she might have been thrashing about and suffering on the ward prior to death. And it's helped some people. But this family said they requested a viewing, they wouldn't let them have it. So I said, well, don't worry. I said, I'll go to Northampton quickly, because I always do. The next day I went to Northampton, picked this person up. I believe it was a woman. But this was first week of December 2019, right? So, and I happened to mention while I was there, because you get to know the staff, And I said, well, the family said you wouldn't do a viewing. Why? Why is that? And I thought perhaps they were having the room done out or refurbishment or, and he opened the door. He didn't say anything. He just opened the viewing room door. And there was a inflatable pandemic tent in there, filling up most of the room. And it was like a kid's bouncy castle, but with loads of pigeonholes in it that are obviously for bodies. And I knew what it was. I had an idea what it was because I'm in the industry. And I kind of said, what's that for? And he said, oh, we've been told there's something really horrible coming. And he didn't mention the word COVID. But he said, we've been told there's something really horrible coming. And that was when I first knew there was something coming. So what do? I kind of went away and I was like, fuck. Okay. Because I'd never known anything like that before. They don't spend money they ain't got to spend. So I rang my mum and I rang my brother and kind of said, well, I've been told this is coming. And then in January, the news broke. And we were shown pictures of people falling over in China in the streets, dying in the streets. And they made real effort to tell us how terrible it was, and it attacked the lungs, and it was a respiratory thing, and I was really frightened. And the first kind of 12, 16 weeks, I believed it. But then I gradually saw through what I knew was a lie. And that was what started me down the road to realising what was going on. And I think the first thing was, when I cast my mind back, like when I came here, we sat here and, you didn't tell me any question you were going to ask me. We had a chat and a coffee. You didn't brief me on what you were going to say and what answers you wanted. It's kind of flowed naturally, I feel. Well, I had a phone call from the BBC. I had a woman and a bloke cameraman turn up at the funeral home. And they said, we want to talk to you about COVID and the precautions you're taking. And I was happy to do that, because you think you're helping. And we was told there was a COVID and I believed it. And this couple sat down and they spent about 40 minutes briefing me on every aspect of what they were going to ask me, and I'd never done an interview before, so you go with the flow. If they're telling you to do that and that's what they want, that's what you do. And I bitterly regret it now because all I did was promote their garbage. They made me sit there in like a mask, and I remember at the time being a bit pissed off because I'd bought a mask to keep myself safe, and everyone was buying PPE and we were struggling to get it because everyone was panicking. And so we were most at risk. And here I am fucking wasting a glove and an apron for a photo shoot thing, you know, but that was what they wanted. And, you know, I was trying to tell people, you know, make sure you're careful. Yeah, there is a COVID. And that's what we was told. And then in about March, April time, I took a phone call from a guy, John, and this was when it really started falling apart. So the first thing was there were no more deaths than normal. It was a regular death rate, but we were picking up people they'd labelled as COVID, but no more of them than normal. So the numbers weren't any different. And then I took a phone call from this guy called John, and he said to me, "Hi, my name's John." He said, "I'm working for a government-sponsored company. So one of the government ministers had this company that he'd set up, like they did with the PPE and everything else, and it was called Pandemic Resilience. And his job was to ring round," he explained himself, he said, "My job is to ring round all of the funeral directors as part of the pandemic response." And I was like, "Okay, what do you need to know? You know, what do you," and he said, "I need to know what your capacity is, first of all, how many you can hold." And I told him, and he said, "I need to know who you've picked up, where from, and how many are COVID. Every week, I'm going to ring on a Monday," he said. "Every Monday, I'm going to ring you." And I was like, "Fine." And I would give him that info, and he'd ring up every Monday. And almost straight away, he started steering me. And by that, I mean, I would say, because I knew that he would ring, I was trying to find out the information to give it to him. So normally I would liaise with the family. I wouldn't ask any questions about COVID or anything like that, because that was pre-COVID. But I was finding out who was COVID, who weren't. Was there a doctor present? Was there a test done? You know, and the circumstances, because I knew this guy would ring on a Monday, and then I could reel off to him, well, I've picked up Jimmy and Tom and the things about it. So this was at a time when the doctors had stopped attending deaths. And we was told that was to protect the NHS, weren't we? And all the doctors were sitting at home with an headset on, working down the phone for a COVID payment on double money. So they were quite happy to do that, you know. And this guy started steering me straight away, and I would say to him, "Right, I picked up a guy from Kent's Care Home, right? And I think it's got 90 beds in this particular care home." And I said he'd been there 5 years. I've liaised with the staff at the point of collection. They told me he was an onset dementia patient. He'd been there 5 years. I then met the family on the Monday, and they confirmed he was there 5 years. He had onset dementia. There was no doctor in attendance. There was no COVID test done. He wasn't COVID. And straight away, he would insist he had to put him down as a COVID death. And I was like, "What do you mean, John? I've just told you." And I remember it got my back up a little bit, because here we are trying to make a pandemic response, and he's fucking the figures. He's lying. And I'm telling him, and I've made the effort, and I'm frightened, and I'm telling him the truth, and he's not listening. And he's openly admitting he's going to put it down as a COVID death. And I said, "Well, why?" And he said to me, he said, "They've been told that in this 90-bed care home, there was one positive test for COVID. And that person then went on to die. Didn't die from COVID, just gave a positive test. So they were under instruction that everyone from that day onwards was to be put as a COVID death, regardless of what they died from." And I remember sitting there and thinking, "You're having a fucking laugh. What's the point in that?" And this went on throughout 2020, everyone they possibly could. And they were paying out big money for every time COVID went on a death certificate. They were getting thousands of pounds, the hospital. So what do you think went on every death certificate? COVID. I had families that were told they would get money towards the funeral if they could put COVID on the death certificate. Unbelievable. Fucking mental. Why would you do that if it wasn't just a push to convince people of COVID? And this went on throughout 2020. And by October, this guy openly admitted to me on the phone, he said, "I don't know why I'm doing this job. Everyone is saying the same thing. There are no COVID deaths." That's what the guy openly admitted to me. And then he said, "I'm not going to be calling no more. There's no need." Well, this was back in October of 2020, before they'd even rolled the jabs out. So Rainer Fulmick put it perfectly on Reflection, where the jabs were never about COVID. COVID was about the jabs and convincing the people of the need for these jabs. So there was no more funerals in 2020 than any other year, but there was loads of COVID deaths. So of course, come January 2021, Everyone's lining up to be saved by a fucking non-existent illness. And I was washing and dressing them the whole way through. The whole way through, every one of them. I had funeral directors sending families to me because they was going to these funeral directors and saying, well, I lost my mum over a Zoom call. I really would like to spend some time with her. And they were all like, no washing, no dressing. I was calling Catholic priests who wouldn't even come and bless a closed fucking coffin. And in the end, I'd ring, they'd say, please ring them, please. It means everything. They'd hang up on me. As soon as my phone, they'd pick up the phone, they'd hear it was me and they would hang up because they knew I'd be asking them to come and bless a closed fucking coffin. That's men of God. And they were Catholic priests. So, and I washed and dressed them all throughout 2020. I never wore a mask because I couldn't fucking breathe in a mask.
So do you not believe in COVID at all?
I believe there was something that was hospitalising people, being that perhaps, and don't get me wrong, I've had the insight to be very privileged position to sit at some very influential meetings with some very clever people, politicians included. Now, I believe there was something that was hospitalising people and the rest was then done with malfeasance in the hospitals. Now, what I would like your listeners to do is cast their mind back to 2020, 2021. What was the only antiviral treatment they would offer a COVID patient? Was a drug called remdesivir, right? So I want people to Google common side effects or side effects of remdesivir and just have a look at the results. There will be loads of results come up. One of them is a website called drugs.com and it's kind of layman terms. It breaks it down. Difficulty breathing, wheeziness, tight chest. Why would you give that to a respiratory patient unless you were trying to generate COVID deaths? That's what they were doing. They were doing it because that was government policy, was the only drugs they were allowed to administer was remdesivir. Have a look at the common side effects of remdesivir. Have a look for yourself. You can Google it on your phone. Tell me if you think it's conducive to the recovery in a respiratory patient. You then put them on ventilation, right? People that didn't even need ventilating were put on a ventilator because they were paid to do that. And then what the ventilator does is it overfills the lungs, tears the lungs, and makes that condition worse. And now, as a funeral director, when I was picking up these COVID patients, they all had the same story, right? Mum never went into hospital with COVID. She went in with a water infection. And then they spam tested her in there until they got a positive result and moved her on the COVID ward. She was asymptomatic. And then they gave her the drugs to make her better, even though she weren't fucking ill. They gave her remdesivir and they ventilated her and she went and died COVID. That's what they were doing. And I was picking these people up that they labelled as COVID deaths, and their body bags were kind of half filled with edema, with fluid. And I'd never, ever seen that before. And I remember before I fully cottoned on thinking, fucking hell, what is this COVID doing that's doing that? And I've since found out. So I was taking them out the bag, draining the fluid off, taking these people out and washing them and dressing them because that's what people should have been doing at the hospital. And they never. They let these people down massively and they had people standing on doorsteps clapping for them. It's fucking insane. I'm never going to stand on a doorstep and clap for the NHS ever. I know what they were doing. And I've been in a COVID ward and watched it happen, right? So these people, they were so bloated, they were filled up with fluid and I couldn't understand why. And they to the point where they'd be crying yellow tears out of every orifice, out of their ears and nose and mouth and all bloated. And even though I'd be really gentle with them, pulling them across, you'd leave handprints in their arms because they're so full of edema. It's the remdesivir because the remdesivir kills their kidneys so their bodies can't process fluid. So they fill up with fluid and they drown and there's your respiratory illness.
And so is this what you were telling the public when you was making videos?
Yeah, 100%. I've been shouting for 4 years. Now, when I first started shouting, people all said that I was mad. And don't forget, it's a story that's unfolded as it's gone along. So up until kind of midway through 2020, I knew there wasn't really a COVID. And I because I wasn't dying.